All right, this is my wound care video. So first, I would check the doctor's orders for a dressing change and irrigation. Walk into the room, introduce myself. I'm gonna grab 2 identifiers. Can I get your name and date of birth? Check your wristband. I would administer pain medication 30 minutes prior if the patient was experiencing any pain. I would warm my irrigation solution. Raise my bed up to my working height. Only expose what I need to expose. Would provide privacy. Make sure my bed is locked. It is. Okay, I'm gonna wash my hands. Gloves. Alright, so as I remove this, I would note what drainage, how much of it is covering the wound or the cloth. Pack. I would note some serous fluid. Then I'm going to begin assessing the wound. So at first, I do see bone, I see granulation tissue, and I see muscle tissue. I do note that there is undermining, and I see a tunnel at about 1 o'clock, and I see a tunnel at about 9 o'clock. So now I'm going to check for the size, the size of the wound and the depth of the wound. So first, the length is about 5.5 millimeters. And then about 6.5 millimeters. And note the depth. It's about 1 centimeter. I'm also going to notice the depth of the tunneling. Make sure it's not connecting to another tunnel. About 2 millimeters from the one at 1 o'clock. Another 2 millimeters, or another 2 millimeters at the 9 o'clock. So then we remove my gloves, perform hand hygiene, and I would document all of my assessment findings, wash my hands, and now I'm about to get my sterile field ready. I'm gonna pour my sterile solution. It's a new bottle. If it wasn't, I would lip it before pouring. Now I'm gonna get all of my materials. Take a deep bed. My needle. Start literally. Okay, now I'm going to don on my sterile gloves. Okay, so now I'm going to begin to irrigate. So I'm going to draw about 35 milliliters of my sterile solution. And then as I irrigate, I'm going to make sure I don't touch the skin. I'm going to go superior to inferior and do this until the solution runs clear. I'm going to discard that. Then I'm going to take a dry piece of gauze, make sure I keep the sterility of my gloves. Make sure I pat from cleanest to dirtiest. Discard that. Now I'm going to begin packing. So I unravel this, get this right, make sure I wring it out. Sterile cotton swab here. And I will begin packing. And we'll make sure that I pack into any tunneling, that I don't touch the outside skin with my gloves or the cotton swab. And I would pack into, again, any tunneling. make sure I get it wet, make sure I wring it out. Just keep packing away. Okay, I would discard my cotton. I'm going to take a dry piece of gauze, place it over the wound, and then also my ABD pad, making sure I do the blue line up. Place it on. So now I'm done with my sterile field. I can remove my gloves. I'm going to get rid of all of this. I'm going to perform hand hygiene, and I would document that I used 35 milliliters of sterile fluid. I packed 2 wet gauze with 1 dry and an ABD pad. And if the patient reported any type of pain, I would also make sure I document that. I'm gonna secure these. Make sure I would date, time, and place my initials on the ABD pad. And then if I noticed any bright red bleeding, any signs of dehiscence, exservation, any signs of shock, any irrigation retention, I would notify the provider immediately. I would note how much exudate or irrigation fluid was left in the emesis basin. To get my client in a comfortable position, I'm going to make sure that I give him his call light, make sure he's comfortable, lower his bed back down, make sure it's locked, and he has his call light. Shut the door and wash my hands.